I imagine the listeners are saying all of this sounds really daunting and scary, even
Yeah,
just driving.
Sometimes we talk like that, but we have to give it facts. You know, we can't sugarcoat it. And then, well, other colleagues will come into the emotional healing stuff, but up front, the physician has to tell you what's going on. Same way your mechanic and your hairdresser.
I agree. But I also think that persons are able to, well, once they have the information, they're able to adjust their behavior and adjust the way we live and, you know, do our best to improve on our circumstances.
So you raise a very important question. Does knowledge lead to behavior change?
Knowledge without implementation, no.
The research into health behaviors continues, but there's no one-to-one relationship. If you get 1 gram of knowledge, you'll do 1 gram of behavior change. It's people's lives. People live complex lives.
Yes.
What is clear is that there is need for the supportive environment to enable people to make the changes that they need to make. If, for example, you write a prescription for exercise, well, where? How much? How much does it cost? Is it safe? So that's why chronic disease is not a treating chronic disease is not a cut and dry, a doctor prescription, only a medication only. You need to have the supportive environment, the policies, the family network, your church network, your spiritual network to assist you. Granted, there are those persons who, in the face of information they read or information provided by a clinician, nurse, doctor, etc., will say, wow, okay, thank you. I will make that change. But that's a minority.
So what you're saying is, and I agree, the fact that you started off by saying that it's the level of stroke is at emergency levels. It's a huge problem nationally. You're saying also that we need a national response. The individual on their own can try, but we need as a nation now to address this issue and start providing the support and the mechanisms for change.
You know, our colleagues in HIV AIDS care have taught us that we have to change the way in which we talk to people. Some persons are not responsible for the manipulation of the food supply.
Oh, gosh.
Manipulated, adulterated, chemicalized food is cheaper than the healthy stuff. So how can we help people with that? You know, what policies, what fiscal measures we can take? What food production policies can we make to make healthier eating and drinking more affordable? So that's why I keep coming back to the point that it's a collective response, a whole of society response. Yes, there's individual responsibility, but a lot of these risk factors start in childhood.
Yes.
So that individual child is not responsible; it's a dependent. The child is in the care of a parent, right?
Yeah,
or guardian.
Well, one of the things I've noticed is this is July now. Last month was Caribbean Nutrition Month, and you see the HPR, the Health Promotion Unit of the ministry. They've been very active in going out and really trying to educate persons on how to eat properly. They even had a seed drive the other day where you can go to the ministry and you got seedlings from broccoli to beets, and they've been really working, especially I have to say big up to Mistress Duncan And they've been really going out there and trying to empower Kittitians with that knowledge. And then on a wider scope with agriculture, we all saw the whole chronicling of the pineapple situation, where the government brought in 150,000 slips of pineapple. But besides the little tweaks that we have to do, we basically were given a pineapple industry now. And from that industry, if we can produce food and we can produce other products, that would greatly reduce the importation of some of these same chemicalized foods that we're talking about.
So we need a pineapple festival now.
You do.
So the Health Promotion Unit has been doing fantastic work. I joined the ministry proper as Chief Medical Officer in 2004, and they were really doing fantastic work then. But it is clear that the Ministry of Health cannot attack this alone, cannot address this alone. So we need the food producers. We need Ministry of Finance colleagues, because they are responsible for the fiscal policies at the border. I mentioned food producers. We have persons making drinks, making and selling drinks. How much sugar is in there? Is it brown sugar or the less healthy white sugar? And we also have to help people to read labels, because our markets are chock full of chemicalized products, and the labels are in a very, very fine font, and if you're not careful, we will be consuming industrial chemicals which have no use in the body and just create havoc for kidneys and liver.
In a conversation with Dr. Laws, the present CMO, I remember her explaining that the Bureau of Standards are actually in works to create proper labeling and also to restrict the importation of certain chemicals in the food, to produce a labeling system similar to that in the UK, where you have actual warning labels on certain items that people are going to consume. And in states like Florida recently, one of I forget what the person's name is, but they basically did a whole study on the snacks that children consume, and they showed you that like something as simple as like a Twizzler, having one Twizzler, you've gone over your quota for the year as far as chemicals, the dyes, and all of that. So they are really, even in the United States, they're really digging deep and looking at the chemicals in the food and the sugars, the excess sugars and salts and all that sort of stuff.
The United States, God bless them, has been late to the party. Much of this work has been led by other persons, especially in Europe, but we here in the Caribbean have also been working through CARICOM agencies, CARFA. However, it's very difficult for St. Kitts and Nevis on its own to protect our people from the nefarious products, the unhealthy products that pass for food and beverages. So it is going to require a collective CARICOM, Hemisphere, World Health approach. The same approach that was taken to address tobacco. That is ongoing now for unhealthy products, but a little slow.
It's interesting you said for tobacco, because I was just looking at a documentary last night, and we know that cigarettes have warning labels on them as well, that they're carcinogens. Do you know that a lot of preserved meats, like the sausages and I always talk about Vienna sausage and the hams and the luncheon meat and the deli meats, actually have that warning, the carcinogen warning that's being applied to them. Now they're in the same category in some countries as cigarettes.
So let's be clear. The food manufacturers have very deep pockets, and they are able to influence, impact, affect legislation. So, for example, I train in the United States, so I tend to know a little bit about that. what is regarded as organic is not 100% organic. It might be, let's compromise and 95% organic and call it organic, which means it has 5% something that's not supposed to be in there. All right, so it brings me back to the point about the literacy. Well, in my practice, I said to people, if you're reading a label and it goes beyond one line, bet your life, that's a lot of chemicals in that product. And I was a chemistry major at college in the Virgin Islands, and I can't pronounce some of these terms.
I know.
All right? So it's not only, so we're talking about the dyes, red color, yellow, and blue. We're talking about things like parabens, which are hormone disrupting substances in the cosmetics. And a
lot of these are in your creams and so forth.
And then there are the nitrates and the nitrites that are added to preserve meats and make them look red.
Yes.
So look at the psychology. Your meat is supposed to be red, but after you go through the factory, it's not coming out red.
Because a lot of these meats too that is added to the scraps and what we call garbage that they've mushed together and added chemicals to take out this stench, and it's really non-food.
You mean if you look at a YouTube video, how do they make Vienna sausage? You'll stop meeting. So the nitrates and the nitrites are added to cut down on the contamination, because these things are coming from factories in a can. Go to the port, stay on the port on a boat or plane and get here and on the shelf for how many months, and so chemicals have to be added to preserve them.
Preserve it for that time.
But do you know that oranges are colored orange to make them look orange? Because a real orange is not orange; it's yellowish green. All right, so. When we used to get oranges from Dominica, that was great. But then the hurricane, I think, was Irma or Maria, destroyed the crop there. But those oranges were greenish yellow.
So the food definitely is contributing. But besides the food, what about behavioral changes? What behavioral changes can we make? Like when I look at a lot of younger persons, because we have to highlight that these strokes are occurring in not necessarily the older
no, that is correct.
population. They're occurring in a lot of what we consider to be the younger population.
Persons who 40s, some 30s, really, but the numbers in the 40 to 50 age group is particularly 40 to 60 age group, particularly disconcerting, because those are people who are working and contributing to the GDP, to the economy. We want those people to be working. We don't want those persons to be, heaven forbid, a wheelchair, a dependent. All right? They become a tax on the state and on charity. And so that is so we're talking about health and economics here.
Yes.
The link is inextricable. You can't separate it.
Yes.
We want persons to live as long as possible healthily.
And
so they can be productive, look after your family, and pay some taxes to the state.
One of the other health factors that I want to bring in before we close is the smoking. We had Mr. Oliveira here, Dr. Oliveira, last week, and he was speaking about heart attacks and so forth, and the fact that smoking greatly increases your chance of having one of those, and not just the cigarette smoke. The marijuana smoke as well. And we have a population where we're learning that some persons who are now in their 40s, 30s, have been smoking marijuana at very young ages. How does that affect? And could that contribute to the reason why we're seing these incidences happening at this younger age?
Yes. And I'm a defender of children because, that child does not smoke. The child is exposed to the smoke of adults. So smoking of anything means that particulate matter, particles.
You spoke about it with the vehicle.
Getting into your lungs. So smoking of anything, all right? We now have to add to that the exposure to the vehicular pollution. We have more cars in St. Kitts and Nevis, and from time to time you have to stop at a stoplight. And if that vehicle in front of you is belching out,
Oh gosh.
your air condition filter can't handle all of that. Neither mine. And so we are at risk for vehicular pollution, and vehicular pollution is a known hazard to health, especially our heart health and our brain health.
Wow.
And then on top of that, now we have persons who are vaping.
Yes.
And
That's a growing
they,
problem.
persons see and they copy. It must be cool.
I think some people thought that the vaping was a healthier alternative
It
to
is
the
not.
smoking,
It is
but
not.
they've now seen
Because
it's not.
what is happening is that people are making products in their mother's kitchen or garage, put them in a nice package and putting them on the internet. And you just have to, send your credit card number.
And that is something that, when we talk about getting knowledge and empowering the average kitician, this is something that we have to learn. I think we have this idea that because it comes in a pack and a fancy pack, it's better than local, or it's safe, because we envision that in order to do that, there must be some authority somewhere making it. But we have to understand, and in the world we live in, getting a fancy pack and putting out a product is the easiest thing now. And so you have to do your research. Even with brands, you have to know which brands you're buying. You have to educate yourself on what their policies are, what their reviews are, and stuff like that.
So when I was studying in the United States, I understood what this statement means. It's a war for hearts, minds, and wallets. All right? And this is a real war. All right, persons are paid hundreds of thousands of dollars to research us. What do we like? Well, after 400 years of colonialism and slavery, we like salted stuff.
That's
so you add you tweak the product. You can tweak the product for a particular market.
Yeah.
All right, and so this is people are actually studying children. Let's see what sounds appeal to children, what colors appeal to children, and you put that in a cartoon.
My daughter, when she was a baby, there was a little squishy toy on the little kangaroo thing she had. And
a
kangaroo, we call it, like a little chair that has a handle and you can carry it around. And that sound, when you touch it, it sounds exactly like a Lay's bag or a chips bag opening, the same exact sound.
That's fantastic psychology in here.
When I heard that, and she would like as a little thing, that sound got her so excited, and I was like, that's why those chips bag have that sound. And we have to understand that marketing, psychology, all these things, they understand how to capture you, how to make you, in a lot of cases, addicted to some of these substances. And even the colors they use for advertising. My daughter said to me, Mommy, everywhere I go, I see the Coke truck. I see them. I don't want to see them, but I can't help myself. And she's never had a Coke.
So the other two modalities used. One, you use popular artists. So you go to a concert, you watch a Netflix streaming something, and popular artists are twinned with products and services. When cable TV came into St. Kitts and Nevis, it was about entertainment, but it was also about selling products and services, all right? And then in supermarkets, I'm not being hypocritical, I'm just telling you what goes on. The local stuff is at the bottom shelf. The imported stuff is at eye level. So that when you're walking through the canyons or the aisles, you're seeing the imported stuff first. Did you know that?
Well,
and when you get to the cashier, there's some other stuff at eye level.
I agree.
So that is done deliberately.
It depends on where you shop to, because I tell persons shop in the areas that are more affluent, because you get better products, you get better service, right? But I find that in the more affluent...
What are the more affluent
Well,
areas?
in St. Kitts, the division is not much.
Okay.
But say you go to shop in Frigate Bay, right?
I get your point.
You have the tamarind balls and the local stuff at eye level, right on the top. I guess because they're catering to tourists. But even as an agro-processor myself, I find that because I've paid a lot more attention to packaging, you have to, and that's the thing, we have to compete with the unhealthy things. You have to make it as appealing as those, because people have already been hypnotized by that. So if we're going to tackle these behaviors, we have to kind of we have to understand what's going on and find the ways to get around it.
So it is clear, if we can continue to use programs like yours to share with people that there is sorry to use the term, a war, a psychological war going on for your wallet. We will be cooking on gas on that.
Yes.
Because in my experience, in relating to some parents and guardians, they are amazed that this is what's going on in the background or the foreground. That the cartoon that they think that is their child is innocently looking at is actually a full-length commercial for a toy or some junk food.
Yeah, and that's the thing. I find that we're so innocent still as far as understanding this. But before we leave again, I want to highlight, though, that knowledge and implementing this knowledge is so important. And understanding a concept, an economic concept of supply and demand is very important here. Because, again, it's not about feeling helpless or powerless. We have to understand that in every market, demand drives that market. If nobody wants what you're selling, if you want to remain in business, you will adjust. And you can see that persons around the world have been adjusting and understanding what has been going on and demanding better products. So the rise of, products for kids that don't have artificial coloring and healthier options on a whole has been rising globally. And you've had a lot of smaller brands. Again, you have to pay attention to the brand, their policy and what they're about. But you have a lot of brands now coming up to fill that gap. And even in the Caribbean, you're seeing movements now where they are saying that we need to ban certain companies from advertising to kids. Much the same way they took the cigarette ads out of the schools, we have to ban certain ones. And they're saying just because you support us financially doesn't give you the right to corrupt our kids as far as nutrition and so forth, because it's causing so much problem as far as NCDs. The Caribbean has such a high rate. Remember years ago we spoke about the obesity level in St. Kitts. That St. Kitts is for lack of a better word, the most obese
We are front
country.
runner. We are front runner in terms of obesity in the Caribbean.
And in the per capita, per globe. And so it's costing us, again, we spent 86 million on healthcare in 2024.
That's on the federal side, and the Nevis Island administration is another 30 to 40. So that's on public, and then when you add the private expenditure, we are somewhere in the vicinity of 7 to 8% of GDP on healthcare. Wow. And most of that is going to paying to treat preventable diseases. And you add to that the injuries from unsafe road use.
Yes.
That's a compounding factor.
Yes.
Several years ago, you also had the additive effect of the gun violence.
Yes.
Well, that has subsided, mercifully subsided. But the unsafe road use and the consumption of high-fat, high-salt, highly chemicalized and highly sweetened foods and beverages, that has not abated.
No.
Having said that, though, I must say a shout-out to the parents and guardians who I know and some who I don't know, who have made decisions that they're not going to go down the fast food, fast lane road. Right? Special shout out to Rastafarians. Rastafarians have been in the vanguard of healthy eating,
Yes.
and healthy living. We agree to disagree on the smoking. We agree to disagree. We agree to disagree on the smoking because I understand it to be a sacrament, but some people are abusing it.
But most Rastas don't smoke as much as the recreational smoke.
I'm understanding that,
Yes.
that there is a harmful use of the
Yes.
sacrament.
Yes.
All right. Use of cannabis under the rules of a sacrament that use seems to be less of a contention for me. It's less of a contention for me personally. It's the recreational use,
Yeah.
and so but I must say that as someone trained in the Western mode of medicine, again, the HIV/AIDS colleagues have taught me to be a little bit more empathetic with people.
Yes.
Harmful use of substances is actually self-medication.
Yes. And
Persons have
yes.
whatever pain they have in psychic pain, physical pain, that pain needs to be numbed. And they can reach for a substance within their private space to numb that pain. So what we have to do, what we have to continue to do in the health space is to get at what's causing people pain.
I think some of it again is economics. As far as the food, the cheaper food, people feel they can afford the cheaper food more. Persons are working more than ever in human history, longer hours, and so you have a lot of effects.
There's also the keeping up with the
that.
Joneses, putting your hat where your hand can reach, getting into debt.
Well,
and that kind of
I feel like development brings that, and I
Not
think
that-
we're way over.
we getting the signal. We getting the signal.
Yeah, development brings that, because back in the day when everyone lived in a little two-room house and everyone ate the same food, and much people didn't have much. There wasn't much to compare it to. But now, when you have little amongst a population that has way more than before, it's hard to tell people don't keep
Okay,
up.
so the research with the rise in disposable income and the
Yes.
disposable people compared to 40 years ago, the average worker has more money,
Okay, I understand.
and that can lead to changes in consumer behavior.
Yes,
that has been
definitely
proven.
as well.
That has been shown
Most
here in St. Kitts and
definitely.
Nevis, and that is in the literature worldwide. And so we are the Ministry of Health, but we are really the Ministry of Health and the Economy,
Yes.
because we're looking after people, and people drive the economy. And the concern is that too many of our people are becoming sick, injured, too early in life, and are already dependent on the state or on their family
Yes.
when they should be producing.
Yes. So this is a conversation that definitely needs to be extended, and we're definitely going to invite you back on so we can have more of this conversation, because it's very complex, as you said. But I do want to thank you so very much for popping in and having this little conversation with us today. We spoke about a lot of different factors very briefly. Perhaps we need to do once a month where we go into depth more on a particular area. But to the listening audience again, we do have an issue, especially with the
Cerebrovascular accidents, aka stroke. Average of 12 per month for the year so far. The direction in which the graph is going is disconcerting. The warming of the atmosphere is a factor, So we're asking people to stay hydrated with the best two beverages is water and coconut water. Water and coconut water. Alcoholic drinks will make you urinate and dehydrate you.
They actually do.
The sodas will make you urinate and dehydrate you. 5% juice drinks and 1% juice drinks, they are not healthy.
Not at all.
Not
They're
for
they're not even
hydration.
juice.
You don't have to drink Gatorade. Gatorade is for specific use in American football players and stuff. Coconut water, fresh water, and homemade drinks with brown sugar, slightly sweetened.
And fruits.
Or eat fruits, watermelon, pineapple, those are juicy fruits.
Bananas.
So,
Yes.
we have within St. Kitts and Nevis the capacity to live healthily. People tell me, well, doc, it's expensive. So, well, if you think living healthily is expensive, try disease.
Oh gosh.
Well, no, don't try disease. Look at what disease is costing us, because radiation therapy is in the hundreds of thousands of dollars. Chemotherapy is in the tens of thousands. These are highly subsidized. The services here in St. Kitts and Nevis are highly subsidized.
Yes.
Perhaps to the tune of $10 for every $10 the government spends, $100 the government spends to keep a hospital open on St. Kitts and Nevis, and 90% of that is taxpayer subsidized.
Wow. Okay, this has been the Health Link, and we have gone a little over time, but it was well worth it with such good information. And we are here at ZIZ every Tuesday at 1:30 for the Health Link. Everything is connected and your health is the link. So you can tune in. And remember, you can also call in. I know that we are here talking about a lot of things, but if you wish, just ring that phone and we'll take your call. So until next time.
For persons who are wondering, Argentina 3, Egypt 2.
I hope it didn't stress anybody's heart.
Well, yeah, because I wanted Argentina to be out of there.
Thank you again so much, Dr. Martin, for
You're
coming
welcome.
through. I'm Siobhan Richards, and this has been the Health Link on behalf of the Ministry of Health. Thank you.
It's there in abundance. Vitamins and minerals and whole heap of nutrients. Anti-inflammatory and antioxidants. Give your temple a chance, 'cause health is wealth. Vital is vital.